Suman, Das, Sandra, Eder, and others. Cachexia is a syndrome that frequently occurs in patients suffering from chronic infections such as tuberculosis or AIDS. It can be other diseases such as kidney disease and chronic heart failure, but is most commonly observed in cancer. So people with cachexia suffer loss of fatigue, loss of weight, muscle atrophy, weakness, and extreme loss of appetite, even while trying to lose that weight. So the loss of body mass cannot be reversed nutritionally on cachexia, even if the patient eats more food, consuming more calories. The body mass will be lost regardless, confirming that there is a fundamental pathology in place. So cancer-associated cachexia, also known as CAC, is the immediate cause of death and is estimated in 15% of all cancer patients. Pathogenesis of CAC is multifactorial. Central mechanisms regulate appetite, food intake, and energy consumption. Contributing peripheral mechanisms control lipid and carbohydrate mechanisms in various tissues. Severe lipid loss in CAC is driven by changes in lipid catabolism and possibly lipogenesis. The concept that increased triglycerol degradation may contribute to CAC is strongly understood by increased plasma levels of fatty acids, increased lipoic rate upon stimulation, and increased expression of lipid mobilizing factors. Breakdown of fat requires lipolysis of TG stored in cellular lipid droplets and mediated at adipose triglyceride lipase and hormone-sensitive lipids. So from this, the hypothesis was that disruption of fat metabolism may prevent the initiation or the progression of CAC. So in study, in vertebrates, lipolysis is most active in adipose tissue with ATGL predominantly responsible for the initial step and TG hydrolysis, and HSL for hydrolysis of diglycerol. So in the study, it was investigated whether one or both of the lipases are essential for CAC. And in the study, they used wild-type mice. So for the experiment, cachexia was induced in regular wild-type mice, the ATGL deficient mice, and the HSL deficient mice, or B16 melanoma. By injection of Lewis-1 carcinoma cells or B16 melanoma cells. So this chart basically concludes that ablation of ATGL protects the mice from cancer-associated weight loss and cancer-associated loss of adipose tissue. So on the graph, you have the LLC injected mice 14 days after injection. You have 21 days after injection, and B16, 16 days after injection. And across, you have the tumor weight. At the bottom, you have the regular wild-type mice, ATGL deficient mice, and HSL deficient mice. And the regular wild-type mice showed the tumor weight actually increased as opposed to the ATGL deficient mice, which stayed the same. The HSL deficient mice, it decreased a little bit, but it increased a little bit, but not as much as the regular wild-type mice. And the average weight change, the regular wild-type mice, the weight decreased drastically as opposed to ATGL deficient mice, which basically had no effect. In the HSL, it didn't decrease as much as the regular wild-type mice. In cancer patients, CAC not only emaciates adipose tissue, but also consumes skeletal muscle and cardiac muscle. They observed that the LLC and B16 melanoma in mice lowered skeletal muscle mass and heart rate. So from this, for the experiment, they surgically removed the muscle of the wild type mice injected with the LLC and B16. And this basically concludes that the ATGL deficient mice were again protected by the tumor-associated skeletal muscle loss. And this is the graph. You can see the decrease in the skeletal muscle mass in the regular wild type mice. ATGL is pretty much the same. It might decrease a little, and the HSL decreased, but not as much as the wild type. So to test whether the activity of metabolic lipases and white adipose tissue and associates of CAC in humans, they determined that the ATGL and HSL-mediated TG hydrolysis activities of white adipose tissue from autopsy samples of 27 patients. 12 of the individuals that have been diagnosed with form of malignancy, 6 out of 12 designated as the CAC concluded that the CAC patients showed increased TG activity compared with the non-recurrent patients. And so basically everything they did in the experiment matched up with the hypothesis that lipolysis played an important role in the pathogenesis of CAC.